This is the Citi Newsroom. My name is Bobie Osena. After this ribbon is cut, all four corners of the country, all 16 regions and all 275 constituencies will receive ambulances. Now, speaking of the ambulances, they've generated a lot of conversation, a lot of accusations, a lot of finger pointing. The minority have accused governments of being insensitive to the plight of suffering Ghanaians, hence the delay in the sharing of these ambulances. The government says that it wants the full complement of all ambulances, 307 of them, the fitting of trackers and the training of emergency medical technicians before sharing these ambulances. Now, today, at the Independence Square, we're here to cover the commissioning and distribution of the ambulances and also speak to all the stakeholders involved with the procurement and sharing of these vehicles. My name is Bobie Osei. I will be speaking to the National Ambulance Service, possibly, and also the ministries involved in all of this. You're watching the Citi Newsroom. I am Bobie Osei. All right, so there you have it. The president making his way to the ribbon section in front of one of the ambulances that he will be commissioning, and this happens to be the Whole West Constituency ambulance. The president has been joined by the vice president, Dr. Mahmoud Bawumia, the health minister, Kwekwajima Menu. He's just cut the ribbon as the president goes around it to inspect. Now, this ambulance happens to be one of 307 parked here at the Independence Square, and after a number of speeches and demonstrations, he's now inspecting this particular ambulance, after which the ambulances are expected to be distributed to all 275 constituencies. Now, still staying on the commissioning of the ambulances, the president has announced that 145 new ambulance service stations are expected to be built across the country to complement the work of the service. Now, this, he says, will go a long way to help with emergency health service delivery.
Today, I'm glad to be presenting to the Ministry of Health 307 brand new state-of-the-art ambulances fitted with advanced life support equipment and tracking devices to be distributed to 275 constituencies. That is one constituency, one ambulance, to be managed by the National Ambulance Service, and the remainder of 32 ambulances to the headquarters of the service. As a result, this means that, as against a scenario whereby one ambulance served approximately 524,000 people at the end of December 2016, today we have a much improved ratio of one ambulance serving approximately 84,000 people. Additionally, in the course of the year, 145 new ambulance stations will be created, bringing the total to 275 stations, ensuring that we have a one constituency, one ambulance station situation. The Ministry of Finance has provided financial clearance for the National Ambulance Service to recruit and train 1,477 emergency medical technicians. Out of this number, 577 have already been recruited, with the process for recruiting the remaining 900 underway.
Well, you're still watching Citi Newsroom. There's a lot of chaos here, but I have here with me the Minister of Health. Senior, today certainly is a special day for you.
I think so.
Yes.
I think I told the president that today I will sleep. After all the bashing, no ambulances, emergency care. When we were doing the drones, there was a lot of bashing. I took them, and I said to the nation that the president promised he would deliver on his pledge.
Now for you, what are the key gains from, this particular?
Actually, this is going to improve on our emergency services very tremendously. We have alerted all our emergency units in all our facilities to get themselves ready. We have trained a lot emergency technicians to go on the ambulances to pick those that we need to pick to take to the stations. This idea of no-bear syndrome, I believe, will begin to become a matter of the past. So emergency services is generally going to be improved. And I believe that will reduce the number of deaths that can be avoided.
Yes, sir. You did mention that as these ambulances leave the Independence Square, we still have some infrastructure issues at some of the constituencies. What exactly are we doing on that, sir?
All constituencies, we are working on them. Yeah. The assemblies are supposed to provide office accommodation and ambulance stations. Those who haven't finished have actually started. I visited a few places and we are on course.
And I cannot let you go without asking you this. I mean, some of the naysayers and some stakeholders are saying that the fanfare around this was not needed. What do you say to that?
That is their opinion, right? What do they mean by fanfare around this is not needed? Yes, this man promised the nation he will do this. He has done it. So people should not know what he has delivered. That is his style. And that is our style. We'll take our time to deliver and we'll showcase to the nation what we have done. I don't think there's anything wrong with this.
Well, also the minister who's been very instrumental, in today's the procurement as well as the commissioning and distribution of these particular ambulances, Madam Hawa Akumsin, the Honourable, and she's here to speak to us. Hello, ma'am. I'm sure you're very, very elated.
Today is a very special day for me because we all know what I have gone through as a minister for the sector superintending over the procurement of this ambulance for years, months, weeks and days. Finally today, God's grace, we have been able to do the distribution, the commission and the distribution as well. And I'm so happy today. It's a day that I'll never forget of. Yeah.
Now, for a lot of people, there's been a lot of fanfare here. A lot of people are happy, but the hard work actually somewhat begins in terms of systems that are being put in place to maintain these ambulances, make sure that the EMTs that have been employed are also well taken care of. What systems do you have in place to ensure that these ambulances are well taken care of in the constituencies as well as the personnel that are manning them?
Thank you. As you rightly mentioned that even though we have distributed the ambulances, the hard work continues. So this is the beginning of the whole thing, how to maintain them. So we have actually put in place maintenance manual that will help the people, the paramedics to go through. And also we have the services centers for them in case of any need for servicing, they can just quickly go there. They don't need to travel all the way to Accra. Yeah, and they also have vans to do mobile servicing. So it's going to make the service process very, very easy for them in their constituency. And I believe this will sustain the ambulance service. We know previously that the ambulance lifetime is about 5 years. But this time, as we rightly heard the CEO saying that it can take us about 12 years if we keep the maintenance culture, which we are going to make sure in collaboration with the Ghana National Ambulance Service. We're going to work as we started from the beginning. So today we are going to continue. We will not end it today.
So the ambulances have been commissioned by the president, and one by one they keep trickling out of the Independence Square. But how do ordinary Ghanaians get access to the ambulance in case of an emergency? My colleague Kojo Ajiman caught up with the CEO of the National Ambulance Service, Professor Ahmed Nuhu Zakaria.
So simply, if it's an emergency, in order that they sieve the prank calls, they would definitely want to interrogate you a bit to see how serious or how true your call really is. And based on that, they are able to really differentiate between the prank calls and the real calls. So if they ask you, okay, Mr. Ajman, where are you calling from? You say, I'm calling from the house. Where do you stay? I stay in Kokomlemle. They'll ask you then, okay, what's the problem? You say, oh, please, I'm not feeling well. Obviously, it's been established that you really need the ambulance. So straight away, they will route your call to the ambulance service. So definitely it will get to the console, the call-taking console in the ambulance service. So definitely they will see all your communication, and then they will start typing your information and everything. Once they are done with all the information that they need from you, the direction, the address, and all that, if you're able to even give the GPS system all the better, otherwise they will just get the location. Then they will now transmit what we call the dispatch. They will dispatch you to the ambulance. In the ambulance, they have the tablets. So the tablets, when the paramedics are in there and they log in, what they will observe, obviously, is the fact that a call is coming in, then they accept. So when they accept, automatically your location, everything, it will generate an address system for you. So like the Google Map kind of system, on the screen now will be the navigation system, which definitely will open up. And then the paramedics will now be able to come straight to you without you now having to describe where you are. So definitely they will then come. And when they arrive, they will definitely, like you saw in the simulation exercise, depending on the type of medical care you need, they will do the assessment. If they need to provide you with oxygen whilst they're even going to the hospital, they will do that. If they need to provide any type of intervention, then they will do that.
Hold on, it means that whilst you are being transported, an intensive care system is on the ambulance before you get to the hospital.
So that's why they call it pre-hospital emergency care system. So it's out of hospital emergency care.
Now, whereas the president just finished commissioning and ordering for the distribution of the 307 ambulances, the minority in parliament is demanding the immediate utilization of the Unyado medical outreach vans brought into the country in 2014 to assist in delivery of health care. Now, 8 vans are currently parked at the biomedical engineering unit of the Kolebu Teaching Hospital, seemingly abandoned. Now addressing the media, ranking member on the health committee, Kwabena Minta Akando, says there is no justification for the situation with the vans.
These vans were bought about 6 years ago, and they were deployed to the hard-to-reach areas, the hinterlands, to provide healthcare services to the good people of this country. Unfortunately, for more than 3 years now, these vans has been parked here and it's rotting away. We took you around and you saw it for yourselves that, this place is very close to the sea and the vans are rotting away. How are we putting to good use the taxpayers' money? These vans were procured by the taxpayers' money. And I believe that it can be used to save lives in this country. But again, we have parked these vans for more than 3 years. And people need them in the hinterlands. People need them. And they serve various purposes. We have the dental, the ophthalmology, the general medical care, and what have you, the ENT, and all that. And it's quite disheartening. We entered one of the vans, and the interior was chilled. The air conditioning was working. Why have these vans been parked here to rot away? What crime have we committed? And so I believe that as a matter of urgency, I believe that government must put these vans to use.
They should deploy them.
They should deploy them to the various hinterlands to serve the good people of this country.
So the ambulances have been commissioned by the president, and one by one they keep trickling out of the Independence Square. A number of MPs are here to inspect the ambulances. Madam Lydia Hassan of Ayaso West Ward 1, and she's here to inspect her particular ambulance. How do you feel about all of it?
I am so excited. As you can see, we are all overly excited and we are so grateful to His Excellency Nana Akufo-Addo for delivering. We ask for 4 more for Nana and 4 more for my good self.
Now, madam, for a lot of people, these ambulances should have been, delivered a long time ago. How do you feel about, people who are saying that, and the fact that we waited till January 28th?
My brother, it is better late than never. It is here, isn't it? That is what we are excited about. We thank God that it is here.
So what kind of impact? What kind of impact do you think it would have on your, in your?
In my constituency, the health of the people is so dear to our hearts as a constituency and as a nation. So we are thankful. It will go a very long way in reducing, is it death, fatal death, unwanted, prevented, and all that. So this is something that we as a country, not just my constituency or MPP, should be thankful and grateful for. We are so happy.
When should we expect this in the constituency?
Today. That's why we are here. We are moving it right now. In fact, I will drive it. I will drive it myself to the constituency.
Just fine. I know that some MPs have already provided some ambulances. Would this be adding on to other ambulances?
This will be adding on to other one. We have one, so this is going to be the second one in the constituency.
All right, man. Thank you so very much. All right, so the MP for Ayawaso West Waggon constituency, Madam Lydia Hassan, essentially expressing joy, with some of her supporters, and she's saying she'll be moving the ambulance herself into a constituency, and she expects that it will impact emergency health service in Ayawaso West Waggon. We'll still try and speak to some more MPs who are here to inspect and possibly move their ambulances to their constituencies. How are you doing, sir?
I'm doing very well, and you?
You look very excited.
Well, I'm very excited because my people are going to get a good ambulance so that in case of any emergency, this ambulance can go and cut them from wherever that the emergency, the accident is, to a very safety place to the hospitals.
Currently, what is the situation on the ground in Shai? So, if there are, emergency health situations.
Well, in Shiazo, I think maybe I need to review something to you. In Shiazo, we don't have any government health facility there. Almost all the health facilities at the Shiazo are private health facilities, and they have the ambulances. But this is the first time we are going to get such a government facility that will be positioned at a strategic point to attend to all accident victims within the constituency.
So, for your constituents who are watching you now, what exactly should they, count on? I'm sure they will want, these ambulances to be well kept. What exactly, can they look for?
Well, I can assure them that they know what I can do. That is why they elected me to represent them in Parliament, and they know the way I'd go about my things. I don't think none of them have the doubt that we cannot manage this ambulance well. We are going to do it well. We are going to position it in such a way that wherever the place that the ambulance will be positioned will be a place whereby it can attend to the constituency from all the 4 cardinal points, whereby they can get access to accident victims or whoever, somebody who is sick or something there.
One comment that the health minister himself raised was the lack of infrastructure in terms of places to actually house some of these, ambulances. In your, constituency, what systems or what preparations do you have? If this ambulance moves, what exactly do you have a place, to house them?
Yes, we have started. We have identified a place already but
it's not ready.
We're told that we need to identify a place and also build a platform for that. So we have identified a place, we started the platform, the concrete has been cast. Okay. It is left with the roof that we are going to do to house this ambulance. So we are already in advance. And we have even started building a chip compound in one of the constituency, in one of the towns in the constituency, that is Dakojom to be precise. So the ambulance will be where the chip compound is. The chip compound, they have done the roofing, they've also done the plastering, the electrical work has been finished, the doors have been fixed, and there's a platform there to keep for the ambulance to be kept.
Yes, sir. Kennedy can come, the MP for Nshaisu in Ashanti region, looking very excited and assuring that, his ambulance will be well taken care of in his constituency. Well, a lot of people, a lot of excited members of the NPP, as well as, observers, are here right here at the Independence Square.